Well, pretty much. Many thanks for staying with us. In case you're joining us, you're just in time for the big conversation here on KTN Prime, and you talk about matters healthcare, the state of healthcare here in the country. There's been a lot of conversation in regards to matters health, in regards to matters Ebola preparedness, and of course many other issues surrounding the health sector in terms of staffing and all. And here to make sense of all that is the PS for Medical Services, that is Dr. Oluga. Very good evening to you, sir.
Good evening, Ketan. How are you?
I'm doing great, thank you. Thank you for making time.
Me too. I'm doing great.
Well, pretty much. Yeah. Now, Dr. As we speak today, there is the Ebola issue is, being discussed left, right, and center. And the big concern is, the facility and our preparedness as a country, and whether we can be able to handle that particular issue. And just before we start this conversation, I want us to listen to Mr. Marco Rubio and President William Ruto, and then we, of course, dive deep into this conversation.
We cannot and will not allow any cases of Ebola to enter the United States. And so the State Department and other agencies represented here, the Centers for Disease Control, HHS, others, are working very, very hard to contain this crisis to the countries where it's currently located, particularly the Democratic Republic of the Congo. And so we've surged assistance to make sure that is being contained there. And obviously, multiple agencies involved here are also very involved in tracking people, just to make sure that nobody comes into this country that has Ebola and creates a problem for us.
When President Trump asked the government of Kenya to support them by having a center in Laikipia Air Base, I gave the okay because it was an agreement and a partnership with friends who have worked with Kenya for 30, 40 years.
Well, pretty much that is the U.S. Secretary of State, Mr. Marco Rubio, and President William Ruto in regards to this issue of Ebola and the quarantine facility in Laikipia Air Base. And Dr. just to make sense, because the big concern from Kenyans out there is that, first of all, why Kenya? We don't have any Ebola cases, of course, since the one in 1976. And they say, the U.S. says this particular disease is too dangerous for Americans. If it's too dangerous for Americans, then it's surely too dangerous for Kenyans as well. And there's that concern about, have we made the right decision?
Yeah, it's true that Ebola is too dangerous for Kenyans. And it is also true that we have a primary duty to protect Kenyans. And it is also true that we are actually protecting Kenyans as a government. And I think you have played the two leaders there, Secretary of State Marco Rubio and also His Excellency the President. And Kenya has been a good friend of the United States, a great partner in health. The United States as a bilateral partner has been responsible for 35% of our budget. And this has not been to do with Ebola. When we had the HIV pandemic, and at the height of HIV killing almost 60% of Kenyans in the 1990s, it is the United States that came calling in 2001 and really bought our ARVs. Up to now, the United States spends $352 million. You know how much that is? That's around 42 billion Kenya shillings in our healthcare system. About 25 to 30% of our healthcare budget. That has nothing to do with Ebola. That has something to do with all the nets that we distribute for pregnant mothers. Mm-hmm. That has something to do with all the medicines that we inject for our patients in malaria. That has something to do with all the ARVs that we take. Save for now, we also get a significant portion from the Global Fund. But even the Global Fund itself receives 40% of its budget from the United States. The family planning that we get from UNFPA around 2.8 billion. So it comes from the UN organization, UNFPA. But the UNFPA itself gets that money from the United States government. If you're looking at World Food Program, all the money that we get from the World Food Program in humanitarian crisis, 90% comes from the US government. So they have been our good friends. That does not give anyone any license to abdicate our responsibility of protecting Kenyans against Ebola. And I think we have made this case extremely clear. His Excellency, the President, has made this case very clear. I don't know what more Kenyans would want us to say. The Cabinet Secretary has made it very clear, and I have made it also very clear. Our first and foremost responsibility as a government and as a country is to ensure that we protect every single Kenyan from Ebola. And we have done that. Ebola has been around for 50 years, 50 years. And we are not going to drop the ball now. So far, we do not have any single case, not one case of Ebola in this country. Despite the fact that we have a huge establishment in the DRC, KCB is a big bank in the DRC. In fact, it's the biggest bank in the DRC. Equity Bank is the second biggest bank. Okay. Those are two Kenyan banks. Do you know how many employees they have? 2,000. Those two banks alone, actually 2,088. We have our soldiers there. We have a number of Kenyan companies. By this evening, I was counting almost 49 Kenyan companies that are working with the mines. Companies that are either doing occupational health, companies that are either doing logistics in terms of truck business, companies that are providing food in the DRC. So we have a huge presence in the DRC. Now, the second thing is that we have very good relationship with our neighbors. Tomorrow morning, Keitani, if you wake up, visit any construction site. The guy selling for you mandazi and chai is likely to be from DRC. Perhaps they say Burundi. Your hairdresser is likely to be from DRC. Your brother or sister is likely to be ferrying some goods, some cement, something, through a truck. We have 2,000 truck drivers taking goods there. What we are saying as a country is that we are likely to have a case of Ebola either from somebody who is visiting us from DRC or our own person who, because of economic activities, is operating in the DRC. Pretty much. For that reason, we are fully aware that we must protect the Kenyan. We are fully aware that these economic activities must continue, and we have to prepare, because we are better off prepared than being sorry.
Fair enough. Even as you talk about, Kenyans working in the DRC, and I think there were cases of around 37 Kenyans from DRC were in DRC were coming back into the country who were, quarantined. But the concern here is that the facility in Laikipia will be for, U.S. citizens.
We have made that also very clear.
Okay. Will it just be for citizens from the U.S. who have been infected or, exposed to this virus?
Quarantine. Okay. The word quarantine means to separate. It's different from isolation. Okay. So we have two different things: quarantine and isolation. Isolation is for infected person that is being treated. But quarantine means somebody who is coming from a region that has a problem. And we're like, wait a minute, so you just traveled? No, wait. Okay. Keitani, you just traveled. Eh? Okay. Maybe KTN is interested in some huge story about mines, about minerals, okay? And KTN has sent you to cover a story about minerals, maybe gold, okay? You've gone there with your nice voice, you've looked at the mines, okay? But for some reason, you were not aware that there was some other problem called Ebola. Now, you are coming back to Kenya. Wait a minute.
Okay.
Okay?
Fair enough.
In the process of you coming back, WHO has announced, hey, where you are coming from, there's a disease. You are not aware. KTN was not aware when you are going there. When you come back, we have to protect your family, you have to protect the other Kenyans, you have to protect the workers here in KTN. So what do? We say, oh, Keitani, we are sorry, it's not your mistake, it's not Kenya's mistake, it's not DRC's mistake. It's not even the story that you're going to do in the mines mistake. But there's a challenge that we have where you're coming from. There is this issue about Ebola. So we'll keep you in this place until we are sure that you are safe. We are not sure who you interacted with there. You may be safe, you may not be safe. Okay?
And that's the point. You may not be safe as well. So if at all there are cases of, people who are infected with Ebola in that quarantine facility, then that surely poses a risk to Kenyans.
How?
Doesn't it?
Quarantine. Quarantine is for protection.
Exactly. And I've said if at all there will be cases. So when you come,
if there is a case, so this is how we do it. So quarantine. Right now we do a test. Immediately we get you, we do a test.
Okay.
Anyone coming from the DRC, we do a test. We get the results in 6 to 8 hours. After 10 days, we do a test. After 21 days, we do a test. 21 days, we are sure the virus cannot survive more than 21 days. Okay? The virus is likely to show up after 10 days. So 10 days, we do a test. So 6 to 8 hours, we get a test, you are negative. 10 days, we do a test, you're negative. 21 days, we do a test, you're negative. No problem.
Okay. So if that was the case, if it's not, as the notion is out there, why was it so difficult for the US to host these people? Of course, you've said these are people who have not been infected. This is not isolation. This is a quarantine facility. Why is it that it was too difficult for the US to host their own citizens? And they had to...
How far is the US? How far is the US?
Of course it is far.
Yeah. I can't answer for the US, but at least I can insinuate. And
the House Standing Committee in the United States in regards to matters health said this was against a long-standing norm, the sending of these American citizens to Kenya. And in fact, they said the American government, just a moment, Daktari, they said the American government did cut aid to African countries, including Kenya. Why then are they sending Americans to this country?
Kenya was the first country to sign the Health Cooperation Framework. First. I was the chairman of that negotiation. The US government cut aid to all countries, okay? And then they started the process of engaging with countries. We are the first country that the United States has returned what we call strategic assistance. The first. And this is not such, we have 1.4 million Kenyans on ARVs today. 1.4 million Kenyans. This evening, I was writing a letter for the procurement of ARVs because we have now 6 months stock and we need to replenish. Replenishing means I have to use American money to get the ARVs. This has happened for decades. We were the first country to get back on that list, okay? And it is important to understand that this is because of the long-standing partnership and friendship. But there's something different that happened, that we are now on a path to government-owned priorities, investing in the things that are important for Kenya. So what are these things that are important for Kenya? Kenya has strategic interests in the region.
Okay.
Kenya has a position when it comes to global health security. This evening, I am actually from the University of Nairobi. I wish that KTN was there to capture it by themselves. Dr. Marianne Mureithi from the Kenya Alliance for Vaccine Initiative, Gavi, you know what she said? She said they are even the ones that are testing the vaccine for the Bundibugyo strain here at the University of Nairobi. When the vaccine finally comes out for this strain that is not available, Kenya wants to be on top of the map. I mentioned, and I'll repeat, even those samples that confirm that this is a different strain that does not respond to the Zaire strain or the Sudan strain, where was the test done? In Kemri. Because DRC has these laboratories, 5 of them, that can do PCR test. They can confirm that this is Ebola.
Okay.
But they cannot confirm that this Ebola does not respond to the vaccine or the treatment. You know where that test can be done? Here in Kenya. So we have capacity, and this capacity is not just for sitting on it and bragging. This capacity is to show up to the world.
Show up to the world, Dr. But at what cost at the end of the day? Because like you've said, your responsibility as a government...
At no
just a moment. You've said your responsibility as a government is to protect Kenyans. And listening to Kenyans out there, Bwana PS, Kenyans are...
We've had Kenyans.
Kenyans are against this particular, setting up of this particular facility. And there are concerns that, nobody, even key stakeholders are not involved. There were no views collected even from Kenyans. And today, the CS for Health, Bwana Aden Duale, said they will not consult the citizens in regards to this particular issue. So if you're protecting Kenyans at the end of the day, and that is your mandate and your priority as a government, why then can't you consult and listen to what Kenyans are saying?
No, we are listening.
How are you listening?
We are listening. The thing about Ebola, and these things, they are called especially dangerous pathogens, EDPs. So especially dangerous pathogens, when they come, they have the potential to wipe out an entire population. Sorry to say, and I mentioned it in my first video when I first addressed this 5 days ago. You know what I said?
Okay.
I said the diseases do not respect opinions. And that doesn't mean we are not listening. It just means that I have a higher responsibility. Right now, I am the principal secretary in charge of medical services. If we, God forbid, had any case that has been confirmed. Yesterday, I had AR calling me, okay?
Yes, there's a Turkish citizen.
That we had this, and we assisted them, because it's the Ministry of Health that can do a test. There's no private institution in this country that can do a test. Do you hear me? I have a very big responsibility. And this is like, I don't know whether you have a family and a child. It's like you're seeing a child going to the fire. Okay?
Okay.
It's like you're seeing your child crying and they are touching the sharp side of the knife. Is the cry more important than removing their hand from that knife? I have a responsibility as the principal secretary, State Department Medical Services, that if there is any case of Ebola, the country is prepared to treat you, to isolate you, to protect other Kenyans. And because I see a bigger picture, I see the samples coming in from DRC being tested here in Kenya, WHO relying on us. You don't see that. Do you see that? So I have a bigger responsibility, and I know that there's a broken telephone, and we can discuss the broken telephone. The broken telephone is Kenyans are telling us, sorry guys, you guys are talking at us, you're not talking with us. The cry I see from Kenyans, and let me say it in my own words, I see Kenyans saying, you people, please engage with us. We are not as bad, we are just scared of this Ebola. We are not even criticizing what you're doing. We are just saying, why don't we have a conversation? And I'm here on KTN telling Kenyans, let's have a conversation. But you are holding the sharp side of the knife. It will cut your hand.
When you talk about...
You are running to the fire. You're like a child.
When you're talking about having a conversation, Dr.
I have a responsibility to protect you.
When even a section of Laikipia residents were out on Monday to protest against this facility,
It's like a cry.
Two lives
cry.
were lost. So
yeah, very unfortunate.
How then can we have a conversation if that is a scenario? And again, you've not really addressed how Kenyans have been involved. And I just want us to listen to the CS earlier on in Parliament when he said Kenyans will not be consulted, because at the end of the day, the concern is, are Kenyans comfortable with this particular facility? Because of time, just how are you engaging Kenyans in regards to this issue? How are you taking in their views?
No, we're taking Kenyans their views. You know, on this one, there are 3 constituencies that are very important. Very important. The first constituency is the person who is coming in. We have so far screened a lot of people. Over 60,000 people that we have screened, okay? So the person who is coming in, who is coming from the DRC or from Uganda or from somewhere else, we are screening them. That person could easily be like, oh, you're at risk. So we are engaging that person, okay? The second person who is very important here is the health worker. The health worker who is going to put on that hazmat suit, the PPE, to take care of this person who has come from DRC, okay? We are engaging that person. The third person who is extremely important here is the person who owns the infrastructure that treats people. That's the county governments or the people who own hospitals. So all of these people, we have engaged them. The people that
even county governments.
Even county governments.
The governor of Laikipia County, Mr. Joshua Rungu, was out saying they don't want this facility.
But has COG spoken?
But the governor himself.
No, wait.
Must the COG speak? Because
we engage through structures. Even today morning, do you know who we were with today morning?
Dr.
We were with IGF. IGF is called Intergovernmental Forum. So there's something called Intergovernmental Relations Act of 2012. So the act already stipulates the way the national government and the county governments relate.
Dr.
So wait. You see, just like you have called me here, there's a way in which I have to engage with the county governments. So the county governments, I engage them through 3 structures. Number 1 is the IGF, the Intergovernmental Forum, which is the CECs, plus the minister, plus all of us in the ministry. The second forum is through the summit, the president, the chair of the Council of Governors. The third forum is the IGTRC, now writing constitutional mandates, Schedule 4 versus Schedule 1 activities of the Constitution. You understand? So, Keitani, I want to be extremely polite and I want to be extremely persuasive to Kenyans that we have heard you. We have heard the cries. We have a responsibility to protect you. Okay. And our responsibility is also constitutional, just like your right and obligation is constitutional. And our responsibility is judged based on the outcome. Did we do our best to prepare against Ebola? Did we prepare the isolations? Did we prepare the quarantine? Did we prepare the surveillance?
I want us to talk about preparedness, Dr. But in all fairness, if today the governor of Laikipia County is out saying we don't want this facility, it is endangering the lives of the people I represent, and at the end of the day, you've said you spoke with the COG, and I assume they are okay.
Even this morning, we were with the chair, the governor, the COG.
Dr.
Wait. No.
Dr. If the governor is not okay,
no.
How then can the COG approve?
The country must hear this. Governors sat down, and they elected one of them to be a chair of a committee called Health. We were with the Governor Abdul Somad. Governors, just like you can elect your MP, there is something called the law of representation. The law of representation is like, are you a supporter of Arsenal or Manchester?
I unfortunately don't support weak teams, but anyway, I support Manchester United.
You support Manchester, so you support Manchester. Good. So you don't play for Manchester, do you?
I don't.
Thank you. So when you don't play for Manchester, there are 11 players there that are playing for Manchester. True or false?
They've signed contracts.
No.
I'm struggling to understand. I'm struggling to understand how. I'm struggling to understand how you want to use the example of football club when a governor has said no, but the COG has said yes.
Because this
but
is
at the end of the day, this governor represents.
So what do you want me
to
use? Which example do you want me to use?
Have you reached out to the governor of Laikipia County in regards to this issue?
Tell me which governor. Which
the
example?
Governor of Laikipia has come out to say no.
Tell me which example you want me to use.
I mean, something
the
Kenyans
law
can
of
relate.
Representation. Tell me.
It's not about the law of representation.
No, our constitution is very clear about representation.
In all fairness, if the governor is out, if members of parliament in that county are out, if MCs are out to say
the minister was in parliament today talking to the parliament.
Yes.
So
he had a very hard time. To be fair.
Yeah, we do understand. Just like we are having a conversation with you, and by the way, this is very healthy. You know why this is very healthy? Do you know why this is very healthy? Because Kenyans are getting awareness. At the end of the day, I am extremely happy when Kenyans are aware, number one, that there is this dangerous disease called Ebola, okay? Number two, that each one of us have a responsibility to prevent it from getting to Kenya, okay?
Okay.
Including being scared, that's a very nice thing. Because it is important to be scared, because indeed Ebola is dangerous, okay? Number three is that I, as somebody who has been appointed by the person the Kenyans themselves elected, I have a responsibility to do the work that Article 155 of the Constitution mandates me to do, which is to implement what Kenyans voted for. Okay. And what Kenyans voted for is that I hold my office with dignity and order, and that I protect the Constitution and I protect them. And that's what I'm doing by making sure that we have quarantine centers, isolation centers. I give them information. And that we do understand. There is anger. I personally understand it. And I want us to calm down, and I'm persuading all of us, we've had you. We've had you. But what I'm also saying, we've had you, but you are holding the sharp knife, the sharp side of the knife. And I wanted to tell you about...
How are they holding the sharp side of the knife?
The sharp side of the knife is the side that can cut you if you pull it.
But how are Kenyans holding that side?
Because what Kenyans are saying is that, don't do a thing. We don't want this thing. My friend, I just mentioned to you, and you've said it, that there are 37 Kenyans already in quarantine. They are not Americans. They are not Americans.
Let me ask, because of time, again.
You understand what I'm saying?
You're on record saying that we should let professionals handle these particular issues. That is correct.
Yeah.
Today in the National Assembly, the chairperson of the Health Committee, the Member of Parliament for Seme, Dr. James Nyikal, said...
A very respected guy.
Exactly, and I'll quote exactly what he said. It is international standard procedure that patients are treated where they are. They're not transferred. This is a professional, the chairperson of the Health Committee.
Yeah, he's a pediatrician. I'm a physician. I do respect Dr. Nyikal very much. He is our senior in the profession. We've worked with him very closely. We continue to work with him very closely. And he's very right. The protocol is that you contain diseases where they are, okay? You contain diseases where they are. But he has forgotten some 2-3 lines there.
Which ones?
Number one of the lines. If the capacity to manage the containment exists, it's there in the IHR. I was part of the revision of international health regulations.
Okay.
Yeah, that's one.
Okay. So do we have better capacity than the United States?
This disease is not in the United States, it's in the DRC. So when we talk about where the disease is, you're talking about Ituri. Can I tell you something about Ituri? Ituri, and again, you guys are really pushing us to say things because we really respect our region. You know, I have had an opportunity to listen to His Excellency the President. You know what His Excellency the President said? Okay. Which you guys did not air, because you aired only the part where he was talking about the America and his conversation with America.
Which part is that?
The part where you did not air is the part where he was saying that the President himself has said that any support given to DRC And any support given to the region, including the regional offices, the Africa CDC, is welcome support. You understand that? To mean that the DRC needs a lot of support. First and foremost is that the DRC needs a lot of support. That region, Ituri region, is a bit volatile. And it's not in my place to say it. You have seen people banning isolation centers. Did you air that?
Yes, of course, that has been covered.
Did you air that?
Yes.
So when you aired that as a journalist, did you interpret it?
You see, Dr.
No, wait. Did you interpret it?
Dr. The thing here is that...
Wait.
You get it?
No, wait. So, if you have a place where quarantine centers and isolation centers are being attacked and are being burnt down, are those patients safe? Can you even treat them? So, and that's the second thing that the chair of our health committee, a very senior member of this profession, has forgotten. And I'm coming to the third thing that he has forgotten.
Okay, kindly, briefly, because I want to ask a follow-up in regards to that.
The third thing that is forgotten is the capacity to manage the cases. Today I was with Professor Omwanzala and all the professors from the University of Nairobi. They are his age mates, they are his classmates, they are his professional colleagues. I think he needs to talk to them. The capacity to respond to quarantine and to isolation exists right here in Kenya. And so all of these decisions, I know it's a difficult decision, but I want to plead with Kenyans. I personally have been trained in the Infectious Diseases Institute, IDI, Makerere University. Anyone can go there and look at my record. In fact, you can even look at who was the best student there. But that's not the conversation today. The conversation is that we plead with you that we have made the best considered decisions in the best interest of the country, in the best interest of the Kenyan, in the best interest of the situation.
How can you make the best decision in regards to protecting the public when you are clearly not addressing the issues they're raising?
We are addressing the issues that they are raising. That's why I'm here on KTN. If I wasn't addressing these issues, I wouldn't be here.
In terms of involving them, that is what I'm talking about.
We are involving
what
them.
They have to say in regards to
we
that.
had, for example, a conversation after the health workers raised a concern. We have addressed the health workers. You have seen Wachira today on television. He's part of the group that went to Sierra Leone. I've just been meeting before I came here, I was meeting with Evan Majani, who was the WHO representative in Sierra Leone during Ebola. And we were discussing some of the issues that led to the spread of Ebola in Sierra Leone. He's Kenyan. Evan Majani is Kenyan. He's not Zimbabwean, he's not American. He was the WHO representative in Sierra Leone. He's the one I've been meeting 2 minutes before I entered this studio, discussing the things that we need to do. And you know what he says? We're on the right track. Because when we politicize a professional issue, then it's like holding the knife on the wrong side.
How is this issue being politicized?
The issue is being politicized because the issue is being taken out of the realm of decisions that require a medical consideration. And I've told you, like what you've talked about, the health committee chair, my very good friend and my senior, Dr. Nyikal, you yourself as KTN, you aired isolation centers being banned in the DRC. You aired quarantine centers being banned in the DRC. Even CNN aired it. Then you are saying, set up quarantine. And are you listening to yourselves? Are you listening to yourselves?
So, I mean, I'm struggling to understand the argument you're trying to drive, Daktari, that because quarantine facilities were banned and all, then...
So how can you set up a facility where They are being burnt down where there is volatility, where there is insecurity. Are you listening to yourself? Keitani, are you listening to yourself?
You're somewhat diverting from it. I've asked how you're taking the input of Kenyans in regards to this issue, but you're talking about this, quarantine facilities.
The input is that, and I have taken the blame.
Kenyans want to address their own issues.
I've taken the blame. Which are their issues?
That they have issues against the facility, for example, in Laikipia being set up.
But that's why I'm here on KTN. But why did you call me? You called me so that I can engage Kenyans.
And I've asked you, how have you engaged Kenyans?
And I've told you 3 things. I've told you the Kenyans, the 60,000 Kenyans that we are screening, we don't screen you by force. We talk to you. We put you somewhere. We engage them, okay? Because these are the Kenyans that are most at stake. They are the ones that, just by that screening, I can lock you up. You understand? Just by that screening. So we are, 60,000 people isn't a small, I don't know whether there's a stadium here in Kenya that is 60,000 people. Anyway, so those are a lot of people we have engaged. And more, because they are families, they are what, so there's a lot of...
Okay, allow me to reframe my question.
Then the second group that we have engaged is the health workers. And I'm very glad that even my very good friend Davji and the doctors, and I'm very glad because we've met, they have retracted their position. They have said they have.
I was listening to Dr. in the morning.
And what did he say?
Mr. Davji, he has concerns, even in regards to manpower, whether we have enough manpower, whether we've employed enough doctors.
I think you need to talk to him again.
Okay, just let me reframe my question, Dr. Before this agreement was, or before the head of state okayed this particular request by the United States, how were Kenyans engaged? How was the intake of Kenyans put into consideration before this deal was agreed?
I think what we can say is that it wasn't public, but we really did engage Kenyans. We really did engage Kenyans because, you see, the Ministry of Health cannot come up and say that, oh, we have prepared a Lupe. Without, a Lupe is a facility that is managed partly by Kemri, partly by the county government of Busia. We can't do that. We can never make that announcement without engaging the county government of Busia. So we had to have engaged. Kocholia is managed by the county government of Busia, okay? All these facilities, the 23 sites, some of them, most of them are our facilities. We can't have done that.
Okay, let's talk about these facilities.
I personally called our infectious disease experts. I called Dr. Wangai, my very good friend. I called all these doctors. We sat down with them. I don't know what else people consider engagement, but yes, I do understand that maybe I should have called them and then brought them here on NTV so that people say, oh, Dr. Wangai, okay, what do you think?
The decision.
What do I, but I did that. We did that before making the decision. We did that more than 2 weeks ago.
Let's talk about these facilities.
Remember when there was the first Ebola outbreak on the 16th? We did that.
Okay, I want us to talk about these facilities that you're talking about, the 23 facilities. And one interesting fact, even on, when we talked about hosting you, even on our social media platforms, one concern was that, yes, the government says there are 23 facilities, isolation centers, facilities rather, to help in tackling Ebola that are in place. One thing is, this information was not forthcoming before this facility in Laikipia was, talked about. And there's that concern about the flow of information. And even talking about information, Kenyans got wind of the Laikipia facility that will host US citizens because it was aired or, reported under the New York Times. There was no, information in regards to, from the Kenyan government rather, to Kenyans. We had it from somewhere else, such that the government now came in later on to explain. So that, some say it is some sort of secrecy. There's some sort of secrecy. All this has been shrouded in mystery and secrecy. Why is it that there is no clear information? There was no clear information in regards to this.
Well, I think, it's spilled milk. Okay. It's spilled milk. Spilled milk is that, okay, we can hold our position that, okay, yeah, we may not, maybe we thought we had done proper consultations. We thought that we had involved the proper groups that needed to be. Kenyans are like, okay, you didn't consult us, or, there was information being hidden. Spilled milk. Okay, so let's just say that right now, what is important is that we protect you from Ebola. And we are going to do that. And we are doing that. And we have 0 confirmed cases.
Just let us know about the report or the case that was at AR Hospital.
Negative.
Resolved, the guy's negative.
Negative.
But will he still remain under surveillance?
I think my colleague PS already made a statement that during the day. I think he can't remain under surveillance when the test is negative. Also, it's been 22 days since his last contact in Uganda, and so I think and I've already talked with the board of AR this morning, and I also spoke with the doctor. So I think the case is quite clear, and we are very clear to protect all Kenyans. And what I want to tell Kenyans is that please have a high index of suspicion. This conversation is very important. For me, the value in all of this is that Kenyans are alert that we must protect our country. And health is as important a security issue as the borders.
Okay.
And for me, that is a value. That is something that I would like to clap for all the Kenyans. Have high index of suspicion. Anyone who is traveling from Uganda, from the DRC, tourist, relative, please have high index of suspicion. Let's screen them when they develop a fever, when they develop weakness of body or what we call general body malaise, when they develop maybe running stomach, or when they develop any form of bleeding from the mouth, from the nose, from the eyes, from any orifice. Let's have high index of suspicion. Let's turn, there's something that I used to say, and I still say, turning frustration into force. Let's turn this frustration into a big force for the healthcare system, because surveillance remain our best tool. Surveillance remain our best tool, and irrespective of the systems that we have established as a government, and we have established very strong systems of surveillance, the best surveillance is still the citizen.
Fair enough. Let's talk about these facilities and even what Mr. Atela said. Just to highlight a few things, he said, here in the country, in health facilities, Kenyans have to wait for long hours to get services. That is one thing. The long waiting time. He said we don't have enough or the necessary workforce, and that the health system is overstretched. That is the Secretary General of the Kenya Medical Dentists and Practitioners Union. What do you have to say in regards to that?
Yeah, he is right.
So what is the government doing to address that issue? The
president just announced that we are going to employ 5,000 nurses. We have done...
when will that happen, the nurses?
So we are giving ourselves 6 months, because of course the budget has to be passed by Parliament, and then the county public service boards have to sit down, and then they have to advertise. So 6 months. And then this is mainly for maternity, by the way. I have to say that, because we also have a program to prevent maternal and newborn deaths in all our facilities. So I think Davji is very right to say that our facilities are overstretched. That's why when I was here in Nairobi, we built 32 facilities. I think they still need to expand. Recently, the president launched, the Mama na Mtoto initiative, where he was talking about 10 facilities that will be built in conjunction with his friends, the Amson's group, who are also the Bamburi group. I think people have seen everywhere the president goes, he talks about hospital initiatives to try and expand, because the population is increasing. We have to expand the facilities, but also we must say that we have idle facilities. Okay. We have facilities where we just need redistribution of health workers by county governments. We need additional recruitment of health workers to make those facilities functional. And so I think what we need to do with our health workers that we have worked with extremely well is to look at areas where we just need to redesign the jobs, areas where we need to redistribute, and areas where we need to strengthen the system. But our system, the system is a process. It's about, today there may be no medicine in a facility, but I have a mechanism of getting it there. It's like the way they always ask us in Kenya, that, Coca-Cola can get to the remotest kiosk in Turkana. Today, we have last mile distribution. In fact, our vaccine distribution system is one of the best in the entire world. If I get a vaccine today, which when I came in as PS, there was no vaccines. There was a lot of uproar over 80,000 children had missed vaccines. Today, there is no child that has missed a vaccine, including the 80,000 that had missed. We had gotten them. Why? Because we have a system that goes down all the way to the last facility, that I can take a vaccine there, it will get there in one day, and it will get to the child. What I'm saying is that there may be no medicine in that facility.
Okay.
But tomorrow, if I want to get a medicine there, I have a mechanism of getting it there. That is what we call the system.
Okay.
And plus the health worker that is going to use that system. So the health worker may say, okay, I don't have a glove today, I don't have a PPE. You understand? But as long as I have the preparedness that now we are collecting all these materials, now I'm training the healthcare workers, now I am repositioning all these things. This is the way that the system works.
Pretty much.
And that is why we have to work very closely with our health workers, because eventually the health worker must implement all of these things. If the health worker doesn't, then the system doesn't work.
Talking about health workers, how many, you talk about around 2,200 that have been trained.
Yeah, I mean over time, and I talked about from 2013.
How many are you looking to train?
Right now we've trained around 800. In fact, specifically at the surveillance level, I think we've done around 150, but 800 have been trained generally in the country.
What is the target?
The target is to train all health workers, because you know Ebola does not show up like Ebola. It does not come written Ebola. Ebola is me having a fever. Ebola is me getting a headache outside the KTN studios here, and then going to the next facility, which is the next clinic. You understand? Ebola is anyone, a clinical officer with his own facility in Busia. Ebola is, yesterday I was in a shop. Ebola is that guy selling selling Panadol in a community chemist in Mukuru, where there is this guy who has been selling mandazi and tea. He is from the DRC. He is running away from that same volatility. He is running away from war. He has sneaked through a border somewhere in Mount Elgon or somewhere that Kenyans are saying, oh, you know, our borders are porous. That's why the Kenyans must work with us. You understand? This guy going to buy headache Panadol in a chemist in Mukuru, that health worker, that pharmacist or the pharmaceutical technologist, identifying that, hey, by the way, umetoka wapi? You have a headache, you have a fever, hey, when did you come? You know, that is Ebola. That could be Ebola. So Ebola does not come branded that I'm Ebola, the way people are. I saw some Kenyans, you know, putting like a coffin and writing Ebola. No. We are giving people the wrong message. Ebola is anything that resembles any disease, a fever, a flu, a running nose, bleeding from any orifice, general body malaise. The only clue that you have is that this guy has some contact with either somebody who has been in DRC, Ituri, or Kasai, or these regions, or from Uganda. This is the clue. And it could be somebody just coming to buy Panadol. They may not even be going to a clinic. They may not even wait for you in that airport or in that border with a thermogun to take their temperature. That is why the citizen is still the strongest defense against this. And that is why we have to work together. And that is why we are in this together. We fall or rise together. This one, there is no way your government fails and you succeed. It does not happen. It does not. This one is not a... That's why we are saying don't politicize this.
Okay.
There is no way that at now your government has failed on Ebola and you succeed as a citizen. It will never happen. We will rise or fall together.
Okay, pretty much. You've talked about politicizing this issue as such, but the concern is it politicizing something when you are against, when you ask questions about a program, is that politicizing it? Because that is what is happening right now.
Politicizing, you know, politics.
Yeah,
politicizing is saying something for the sake of saying something. For the sake of
Kenyans saying
image.
these things for the sake of saying it then? Do you believe so?
Some.
But not all?
Not all.
What about...
There are many who are genuine.
What about those who are genuine about it?
There are very many who are genuine. And there are very many who are not genuine.
So what are you doing about those that you believe are genuine for that case?
I am listening to them. And I have just said here, time and time without number, we've had you. We are protecting you. We are responding to you. We are doing everything that we have to do to ensure that there is no Ebola in Kenya. And so far, there is no Ebola in Kenya. And we have to, all of us, work towards keeping that status, all of us.
Okay.
And the risk is highest, not from the people that we think are going to bring it. It's highest amongst us.
Pretty much. So at the end of the day, one other concern is, like you've said, you're planning to hire more doctors. If you look at the doctor-to-patient ratio in the country, how far are we in attaining the required standards?
No, we are still very far away from attaining the required standards. We are still at 1 to 16, 17,000 Kenyans. We need 1 to 1,000, one doctor to 1,000 Kenyans. And so one of the things that we really have to do as Kenyans to attain this ratio, we've changed the way in which we finance healthcare. And one of the greatest mechanisms to do that is the Social Health Authority, because the Social Health Authority, if Kenyans register to the Social Health Authority, they pay up to the Social Health Authority, we will no longer have to struggle with employing doctors, because doctors can employ themselves. And this is really the mechanism we want to go to. I told you about very many idle health facilities. I am now working on a program where county governments that have been unable to hire doctors, we are trying to persuade them to give these facilities to the many of our younger doctor colleagues and nurses and clinical officers who come in groups. We train them on management, we train them on good clinical guidelines. They take over this idle facility, they run it, they are supervised on standards, they are supervised on outcomes, and then they are paid from SHA. The money they get from SHA is enough to pay their salaries. That way we are going to solve the access problem by Kenyans, we are going to solve an employment problem, and we are going to solve an outcome problem. And these are the reason why we are telling Kenyans, SHA is a do or die. It's not just about you paying up SHA. It's about giving you the best outcomes, it's about employing that your daughter or your son that you're taking to medical school. It's about establishing the research centers. It's about everything that we want to do as a country, because it's just like when you want to get a good diet in your house, you must have the money. You understand? You can't talk about a good meal when you don't have the money.
Pretty much. We talk about unemployment and the workforce not, really being sufficient. But at the end of the day, we have health practitioners from different counties who are agitating for them to be, fully deployed. I think I saw today there's the health practitioners or workers who are, threatening to go on strike if not, starting that particular strike in Isiolo County. We've had cases of, doctors downing tools in different counties. What is the bone of contention, and how are you trying to fix that issue?
So we're really working with the county governments to honor agreements with health workers. I am one of the signatories of the collective bargaining agreements. In fact, all health workers in this country are earning salaries that I signed. And that's how important for me this issue about health workforce is. In fact, I always say that the health worker is the system, because you will invest in the Social Health Authority, you will invest in the hospital, you will bring equipment the way we have done now, 638 equipments, hospitals, just got equipments flagged by His Excellency the President. But at the end of the day, where the rubber meets the road is how the health worker treats the patient, whether the health worker was available, whether they were competent, whether they were capable, and whether they were available and they did that work that they are competent and capable to do. And so I think this is something that is extremely important for us as a country. That is why health workforce development is one of the key pillars of our health systems transformation. And one of the things that we are very keen to collaborate with county governments is that let's treat health workers very well. As a national government, we've done everything. We've just given doctors 3.5 billion shillings that they have earned in arrears, and this is so that they can treat our patients the way that we are treating them. We're treating them with kids' gloves. Like we are sure that, okay, we have put this huge machine here, but you know, you have to do the CT scan, you have to interpret it properly so that the patient can get a good diagnosis. We know very well that as the PS or as the minister or as the president, I cannot go there to interpret that CT scan. There has to be a radiologist to do that. And that interpretation of the CT scan determines whether the ordinary Kenyan gets a proper diagnosis or not. So we are telling them, I have done my work. I have placed this CT scan that is worth 300 million. That is why I have paid you 3.5 billion. So that when this Kenyan comes, please just read this CT scan, okay? So that we do not have to delay the diagnosis of this Kenyan to get a proper surgery. When this Kenyan comes, please make sure you do the surgery properly. When this Kenyan comes, make sure that they are not in pain. And this is a message that for me, as Dr. Oluga, I really want Kenyans to help me and to rally me so that we can get our health workers to treat our patients with the dignity with which we as a government are treating them.
Fair enough. Just one other issue about Kenyatta Hospital. There were concerns about Kenyatta Hospital and it, facing technical insolvency. They have debt issues. How can we go about that? Because it is, the biggest facility that we have.
So there's a big transformation that's happening in our referral hospitals, and I believe this is part of the transformation. So there are three things that are happening. Number one is the issues around revenue. So if you look at Nairobi Hospital, Aga Khan, all of these hospitals, they are standing on their own. So we are thinking that, Kenyatta National Hospital should also stand on its own. We do understand that there's a huge population of Kenyans that can't afford and won't afford. And we spend around 1.2 billion Kenya shillings on these Kenyans who, they won't pay, they can't pay because they have no means. But this is also the reason why SHA is important. Now, on that revenue measure, we have to work on revenue leakages around Kenyatta. That's why we are doing digitization there, but that is also why we are doing reprioritization there. But the second big issue is the fact that we have to look at the services that we give in Kenyatta National Hospital, so that they are aligned to the Kenyan. There are so many Kenyans who travel from Meru, from Migori, from Busia to come there. They travel the entire night in a bus. They line in Kenyatta for 6 hours only to see a doctor for 5 minutes. Is this the best use of that specialist doctor? Is this the best use of even the Kenyan? Can we decentralize some of these services with using technology? So there's a lot of transformation. But then the last bit is that yesterday we were discussing the issue about every woman, every newborn everywhere. Basically women who are dying during delivery, and we have 15 of them every day. And now His Excellency has launched this rapid results initiative to ensure that we stop these deaths. Now, Kenyatta National Hospital has a role, because if there are all these maternal cases being referred to Kenyatta and then they are dying at Kenyatta, whether they are late referral or not, Kenyatta has 52 professors, specialists. These are the top of the top of the top, including the president of FIGO. The president of FIGO, Dr. Kihara, is also one in Kenyatta. So you are the top doctor in the world. Now, what I want you as Kenyatta to do is to go down to where that case came from, whether it was from Pumwani, whether it was from a small facility, and train them and tell them, okay, this case was warranted, this one was a special, this one required me, but the other case that you referred did not require me. Please next time do this, do that, do that, do that. That way, we are going to solve all those problems of insolvency. And we are also injecting a lot of money in Kenyatta. Of course, right now, we are working very closely with the CEO, who has done a very good job to ensure that we solve the previous challenges. Kenyatta had a huge debt, especially the debt in pension. I think that's what you're talking about. We inherited, when I came in, a debt of 17.9 billion in pension, in what we call the debit fund. And I think that may be what you are talking about as the insolvency. But this is something that has been accumulating over 20 years, was from 2016. And these are some of the challenges that we are trying to correct.
Well, we're running out of time. This is your camera, Dr. Ari. There are concerns from health workers, especially in regards to the issue of Ebola. There are concerns from Kenyans. what do you have to tell them today about, as a representative, as a, a government officer who's there to protect and agitate for better healthcare, to ensure they're safe, to ensure there's proper medication, to ensure they have access to, healthcare that is of the highest quality?
Colleagues, when the world faces a crisis that threatens humanity, like Ebola, like COVID, this is our time to show up. This is our time to stand up. This is our time to be the voices of reason. We have a legitimate concern to be protected, to be provided with the tools, with the PPEs, the personal protective equipment, with the medications, with the equipment, with the diagnostics that we need to protect the patients. But we are the ones with the knowledge. We are the ones who went to school to do this. At one point in the world, every disease, whether it is infectious, whether it is metabolic, whether it is genetic, did not have a countermeasure. It did not have a vaccine. It did not have a medication. It did not have a surgery. Somebody, a health worker like you, stood up, used the tools that we now want to provide to you to invent, to innovate, or to perform that countermeasure. This is our call. Thank you.
Fair enough. Thank you very much, Bwana Pierce, for making time to be with us this evening.
Thank you. Thank you, Keitani.
Pretty much.